Hi, my name is Gabby Miller, and I go to Nebraska Methodist College. I did my leadership analysis on nurse-to-nurse bullying. Why I selected this area to research? Well, to begin, when I first did my research log number 1, what really stood out to me was workplace bullying. I decided this was the topic I wanted to research, and after researching workplace bullying, I decided it was too broad of a category. So I narrowed it down, and I kind of thought of what areas pertain to myself, and I figured nurse-to-nurse bullying was something that very much pertained to me and the career I was going into. When I narrowed it down to nurse-to-nurse bullying, because it seemed a very interesting topic too, and something that was very, unfortunately, common. I personally do not work in the healthcare setting right now, and I'm not exposed to how nurses treat each other, so it's something that was very interesting to me and stood out. What I originally hoped to learn from the research? Well, I originally hoped to learn something about leadership. Since this is a leadership class, I wanted to see if leadership does or does not play a role in nurse-to-nurse bullying. This brought me to my research question, which was, how can leadership prevent nurses bullying other nurses? After reading and researching items that pertain to this, I then declared my thesis as effective leadership roles can minimize nurse-to-nurse bullying by recognizing the bullying is happening, by making sure not to minimize the situation, and by confronting the situation. So first, when I started doing my paper, I started with an interview. I interviewed a gentleman by the name of Owen Schreiber. He was the associate nurse manager for the solid organ transplant floor at Nebraska Medicine. He has held this title for a little over a year, and he has worked for Nebraska Medicine for over 9 years. His roles and responsibilities include things such as taking care of the staff, following up on incident reports, balancing the schedule, managing leaves, hiring, and initiating corrective action if necessary. He is accountable for the staff and for their attendance. Schreiber described himself as a passive leader who is working on being more assertive. According to the Assertive Workbook, the result of the passive style gives people control over our lives, even when we do not want so. This is according to Patterson in 2000 on page 13. Schreiber states he feels crucial conversations are hard for him. Corrective criticism is hard for him to give, but he does state he is very good at saying nice things. He's always a positive person, always trying to give high fives. He stated his favorite part of his job was hearing about all the awesome things his staff does and makes him very proud as a leader. When asked about his philosophy style, Schreiber just stated positivity. He believes in positivity. He also believes people want to do good at their job. They do not just want to go through the motions of doing their job. If something negative were to happen, and when it does happen, he believes the staff always has positive intentions. He always tries to give the staff the benefit of the doubt. In Introduction to Leadership, this was theory Y. According to Northouse, the average person does not inherently dislike work. Doing work is as natural as play. Rather than viewing work as a burden, the assumption suggests people see work as satisfying and not as a punishment. Schreiber's vision as a leader is a nursing utopia. He wants nurse satisfaction along with patient satisfaction within a budget. The unit he works on is mostly young, newly graduated nurses. He says they stay for an average of around 3 years, and then they blossom professionally, and they kind of move on from his floor, but his floor is a lot of younger, newly graduates. I asked Schreiber if he has ever witnessed nurse-to-nurse bullying, and he kind of just laughed. He exclaimed bullying was a perception. In his own experience, the nurses are not being bullied. The nurses just feel they're being bullied because they don't understand the other's perception. Schreiber kind of explained that nurses need to grow up and realize not everyone's their best friend and they need to get tougher skin. He explained how people need to stop worrying about how others think of them, especially in a professional setting. They don't all need to be friends, they just need to get along. When Schreiber was asked if there was anything more he wished he could do when he observed nurse bullying by other nurses. He just simply explained some people have rough communication skills and it's not always personal. Perceptions are really hard to understand. He wishes he could just get more people to see this and get more people to understand each other's perception more so they can kind of see the other's perception, not that they're bullying, just that how they are as a person, kind of. He explained how nurses do not all need to be friends, but they do need to understand both sides of the stories, not just their own, and always feel that they're a victim. Which was kind of interesting, because then I researched 2 scholarly articles. One was Strategies for Eliminating Nurse-to-Nurse Bullying, and this article, written by Thompson in 2013, he exclaims how nurse-to-nurse bullying is a huge problem all over. 46 to 100% of nurses get bullied in their career, and 80% of people witness some form of bullying. 51% are other nurses. He exclaims how nursing is destructive, unprofessional, and exemplifies caring. Victims of bullying, Thompson explains, often suffer emotionally, and this can lead to physical pain, humiliation, lack of confidence, and lack of self-worth. Thompson also states that environments with high percentages of bullying have higher patient mortality rates. He believes that there's 4 steps to eliminating bullying. Step 1 is the nurse needs to recognize it's happening along with the leader. Step 2, one needs to separate themselves from the bully. Step 3, the victim actually needs to speak up to the bullying, and if they can't do that, maybe the nurse leader or someone close to them. And step 4 is having others confront the bully as well, kind of trying to see what they're doing wrong and put them in their place. In the other article I read, The Psychology, Distress, and Workplace Bullying Among RNs, on the online journal of Issues in Nursing, it was written by Barry, Gillespie, Fisher, Gormley, and Haynes. They found that bullying leads to difficult workplaces for registered nurses. It creates a stressful environment and may lead to a sense of powerlessness to the nurse that's being victimized, which can lead to psychological distress such as anxiety, as stated in the other article. One finding in this article showed that bullying was linked to increased stress and anxiety and can stimulate people's PTSD symptoms. It shows respondents, nurse leaders, and human resources often minimalize bullying, as it seems that Schreiber does, and behaviors, and they lack recognition. They seem to ignore and they minimize the bullying. Many nurses go to their families as an avenue for venting, but this article showed that on-site peer support, if a nurse were to vent to another nurse, it not only makes the nurse feel better, but it has other nurses come out as well, because a lot of times it's hard for the victim to come out and say, I'm being bullied, but if one person can step up and say it, others kind of follow. Solution to nurse bullying in this article is the nurse leader. They believe nurse leaders must coach new nurses on professionally addressing bullying. New nurses must be empowered by the leaders on the clear lines of professional expectations. Targets and bystanders also need to be educated on how to speak up, when to speak up, items like this. And this article just explains how no nurse is ever immune to bullying. Nurse leaders must empower directly all the nurses on the floor. Sorry. This article, both of these articles together, they both kind of have interrelated concepts and themes. Both agree that victims of bullying suffer through anxiety, through depression, through things like that. Both agree bullying is unprofessional and affects patient care. They both also had ways to deal with both of them had ways to deal with bullying. And they both agree that leadership in the hospital must come forward and help as well. Relevant to the topic of my paper, this is because by showing if a leader was more effective in helping with nurse-to-nurse bullying, nurse-to-nurse bullying can be eliminated, or at least less than it is now. So both these papers just kind of show that leadership plays a huge role in how nurses perceive one another. When comparing and contrasting the articles of the interview, I found a few things similar, such as the 4 steps to eliminating bullying by Thompson were kind of similar to how Trieber feels nurses should handle bullying. Trieber wants to deal with very little to no drama, and he tells the nurses that they are adults and professionals. He explains to them they need to talk to the person they have a problem with, which in the 4 steps by Thompson, he also explains that the victim should try to come forward and confront the bully and things like that. If they can't, the leader should definitely step up. But they both feel that the victim should come forward and try to confront the victim, or the bully. When contrasting these, there's quite a few things to contrast. In the article by Barry Gillespie, Fisher, Glomer, and Hayes, this shows nurse leaders are being more effective and are not minimalizing bullying. But after talking to Trieber, I kind of saw that he feels nurses need to figure it out and to handle bullying themselves. He kind of pushes it away, he ignores it, he minimalizes it. And Trieber's outlook contradicts this, which Barry, Gillespie, Fisher, Glomer, and Hayes' theory of anti-minimalization. Trieber definitely is minimalizing. Also in the article by Barry, Gillespie, Fisher, Glomer, and Hayes, who believe managing nurse-to-nurse bullying is done by providing further resources to nurses who are being bullied. They believe that the nurse leader nowadays is not only helping, but they also feel that they're giving them resources, things to help them. But when I talked to Trieber, he stated that bullying resources do exist, but he is not aware of how to access these resources. This just proves while research believes bullying resources are being utilized, the actual practice of Trieber's unit shows that these resources are not. So that was kind of contradicting. Some strengths and weaknesses in my paper. I would say a very good strength is that my articles seem to be very reliable. They were scholarly articles. They were peer-reviewed, things like that. But the weaknesses in that, in the Psychology, Distress, and Workplace Bullying Among RNs on the Online Journal of Issues of Nursing by Barry, Gillespie, Fisher, Glomer, and Hayes. The interviewees, the people who were interviewed for this article, were mostly white. 90.9% of them were white, and 81.9% of them are female. So it makes the article biased in a way. So that was a weakness of this paper. Trieber also included the fact that he had only been a leader for a year, so that can also be a weakness because he hasn't experienced as much as someone who has been a leader for, let's say, 10 years. So that could also have been a flaw in my analysis. So kind of just to conclude in my paper, it just shows that effective leadership is a crucial part in eliminating nurse-to-nurse bullying. Many leaders, as the one I interviewed, minimalize bullying. Articles show and have proven how hurtful and prevalent bullying is in the workplace, even if the leaders don't want to see it. Both articles focus on steps of effective leadership as well as how crucial leadership is in getting rid of and eliminating bullying. A safe work environment is very crucial when working in the healthcare setting, and safety for the patient and the healthcare team should be one of the top goals in the unit. When there's bullying happening, this safety is not present. Bullying has no place in professional environment made for caring and compassion. There's no place for this kind of negativity in a caring environment, as Thompson states in his article. By having effective leadership roles, nurse-to-nurse bullying can be minimalized. It can be minimalized. And simply recognizing bullying is happening by making sure not to minimalize the situation and by confronting the situation can eliminate this nurse-to-nurse bullying. So if leaders come together and see that they are minimalizing bullying and they cannot do that, it can create a bully-free environment, which is something we want. And then next, these are just, like I said, the resources I use, the 2 scholarly articles and then my textbooks. I hope you learned a lot from my paper. And thank you for listening.